St. Vincent and the Grenadines, and in particular the Ministry of Health, Wellness and the Environment, among other ministries, have benefited from the Japan's grant assistance for Grassroot Human Security Projects, GGP. The GGP provides grant assistance to suitable organizations to assist implement their self-supporting and socio-economic development activities, which are designed to benefit the grassroots level. In principle, the limit of grant assistance is approximately some US 100,000, which may change in St. Vincent due to exchange rate. However, financial donations only represent one component of the GGP, as it also requires that the recipient be responsible for periodic reports, the completion of the project as originally planned, proper accounting and submissions of accounting statements for the grant, as well as proper maintenance of the project's outcome at least 5 years after the completion. One eligible recipient would include non-profit organization, hospitals, or medical institute, which is where the Ministry of Health, Wellness and the Environment benefited. As a result of this, Japan's ambassador with responsibility for St. Vincent and the Grenadines, His Excellency Mishuhuko Okeda, toured the hospital lab and a mobile blood bank unit to see the items that were purchased under the Japan Grassroot for Social Security project. A detailed examination and evaluation was conducted through the tour with healthcare professionals, which included Administrative Officer Roxanne Williams, Acting Deputy Administrator Andrew Williams, and Acting Chief Laboratory Technologist Elliot Samuels, who guided the process and gave the ambassador the necessary feedback.
And she's the Administrative Assistant in the Health Department, the Health Planning Office, and she'll just tell us a little bit about the Grassroot Project.
Grassroot Project, it's a project funded by the government of Japan for NGOs and non-governmental organizations. It assists in community projects such as water harvesting, like community clinics, community hospitals, community schools, things of that nature.
And how have the Ministry of Health benefited in this project?
Well, the Ministry has benefited in that we were able to garner from this project some blood bank equipment to operate our mobile blood bank, and we have also procured a bronchoscope and some urology equipment.
We're here with Mr. Elliot Samuels, and he's the Acting Chief Laboratory Technologist. You received some equipment through this grant project. Tell me, how will this enable your department to function in terms of its delivery of healthcare?
Well, as part of the mandate to strengthen the delivery of health services in St. Vincent and the Grenadines, the government, through the external partners, PANCAP, procured a mobile blood bank, and we have had this unit for about 8 years. And because of the absence of some key pieces of equipment, we were unable to operationalize the unit. Now, we are truly and sincerely grateful for the grant that we have received from the Grassroot Project. We have received a tube mixer, two blood bag mixers. We have received a tube sealer and also a combust centrifuge. Now, this would really allow us to strengthen our capacity in order to enable us to deliver safer and more reliable blood supply to the people of St. Vincent and the Grenadines.
Okay, what is breaking this down into terms of human, the regular person who is not of a scientific background can understand? What does this mean for Vincentians?
Well, it means now that we are going to be expanding the pool of blood that we collect from the public. As it is now, we rely totally on a replacement system. So persons would only come to the hospital and give blood when their loved one is in need. We have about 3% voluntary blood donation that occurs within the country. And we are hoping to extend that pool of voluntary donors to involve more people. So we are going to be reaching out to the faith-based institutions, the educational institutions, the community as a whole, through our mobile unit to encourage people to become a voluntary blood donor. We hope to expand our blood collection facility and the quantity of blood we have in the hospital by about 20 to 50%. So we are going to be providing more blood and blood products that are safer and reliable to the persons who need it most in St. Vincent and the Grenadines.
Okay, how do you feel about this partnership with with Japan to provide us with this?
I am elated about the partnership. I am truly thankful for the Grassroot Project. As I mentioned before, we have had this unit for 8 years. and because of the absence of some key pieces of equipment, we were unable to operationalize. So we are truly grateful for the input, the funding that has been provided, so we can now have this unit operationalized by hopefully the end of January 2017.
We're here with Andrew Williams, and he's the acting deputy administrator, and he's going to tell us about how the hospital itself on a whole will or would have benefited from the proceeds received from the Grassroot Project.
Okay, so far the Japanese Grassroot Project have donated a set of equipment and supplies to the Milton Cato Memorial Hospital. So far we have benefited in blood bank equipment and supplies, bronchoscope, some urology supplies as well. For this donation we are quite grateful, and the clients who would be the patients would benefit a lot, especially persons who undergo surgery at the hospital. From time to time we would have to make known our demands for blood in sending out requests to get persons to come and donate blood. In this regard, now with this donation, we would be reaching into the district, into the rural areas, and collecting blood and bringing it back to hospital, which would be most rewarding for the patients who undergo surgery.
So it is safe to say it has put the hospital in a better position to service the people of St. Vincent and the Grenadines?
Yes, of course, in that regard.
Other members of staff and a representative from the Ministry of Foreign Affairs, along with members of the regional media, was on hand in the walkthrough with the ambassador.